I'd like to welcome Dr. Worple here today. You've been here just almost 5 years. You're also kind of our resident expert in the Da Vinci.
It allows me to use very small instruments that are the robot, but I manipulate everything, so it's all my hand motion inside the patient's body. It's a platform that allows surgeons to use the skills that they have both open and laparoscopically and kind of combine that approach. So the motions that the robot is able to mimic of my hands allows us to perform very detailed, delicate work.
Great for our patients, great for our community now to have access to this. And so better outcomes for the patient, less bleeding, smaller incisions.
Better mobilization of hard to reach areas and much better visualization for the surgeon compared to even a laparoscopic camera. Decreased stays in the hospital after certain procedures.
Wow.
But like you mentioned, decreased bleeding risk, decreased infection risk.
You were trained on the Da Vinci and started when you were in med school and in your surgical residency. I wanted to kind of go back a little bit. Why did you want to be a surgeon?
Once I started medical school, I found I really liked the hands-on aspect of being a surgeon. So, somebody comes in with a problem, you fix it. It's a very instant gratification for both you and the patient. I really like forming that very intimate and important connection very quickly with my patients. And that's something that's very unique to surgery.
It is, and really a lot of what you do is life-saving work. You are taking care of an immediate problem that is just has to be resolved.
I really like that breadth of practice, and it allows me to kind of work with all different populations of patients. Being able to do breast and then follow that by a hernia, follow that by a melanoma or a colon case.
We're doing, I think the last statistic is around 5,500 procedures here a year, and so kind of tell us how the recruitment of general surgeons to Fort Dodge, how are we doing? What are you excited about?
The administration and UnityPoint has done an amazing job of really making it a focal point to find what our community needs, what type of providers. I think, the cardiology space has been a great example of that. And then the surgery renovation, redoing our ORs so we can provide quality care to our patients in a space that's much needed. And then bringing in robotics. All of those things allow providers to know that we're providing a high level of care in an area that really needs it, and that is kind of what draws physicians to the area.
What brought you here to Fort Dodge?
As a medical student, I actually rotated here in Fort Dodge, and that was a blessing. I found in that some mentors with Dr. Miyagi and Dr. Willerth. I really enjoyed the community. That's a medium-sized to smaller community, and a hospital that offers so many different services for our patients. So kind of that small community feel, but the ability to really provide great care for my patients.
Thank you for all that you do for us here in Fort Dodge. You are seen to be just a physician that provides excellent quality of care. I know the surgery team loves working with you. Not only are you an excellent surgeon, but you're kind.
And so, thank you, I appreciate that.
And I hear that from your patients too. So thank you for all that you do here at UnityPoint Health Fort Dodge.